now we have degenerative joint disease. And then, like we mentioned before, technically that's the actual vertebral bodies, especially the end plates, and then the facet joints. So you can have disc degeneration, I mean, you can have arthritis of the vertebral bodies, and then you can have facet arthropathy. Okay, so it doesn't cause so much of a problem when it goes out to the front, but if it goes into the back, if there's a solid bar of degenerative changes in the vertebral body, like I said here, if it's back here, it'll affect the spinal cord. Okay? And you can get bilateral leg pain. Or if it's going out to the side, from either from the facet or from the vertebral body, and it can affect the IVF. And so then here you see, here there's changes on the x-ray, and then here's these osteophytic bridges that go across the vertebra. Basically what's happening is your body is getting wear and tear to the disc, and as its safety mechanism, what it's doing is it's bracing that whole area, so it's extending the bone so that it meets, and basically it's just stopping motion there. You know, your body says, that motion right there, we're not too happy with that, let's close it down. So like here, you can see there where if those osteophytes are in the back, it can affect the spinal cord. And then that's central canal stenosis.
So it's not really the degeneration, it's what is replacing the degeneration, which is causing the problem. In other words, all the osteophytes and things.
Well, the process of degeneration is the formation of the osteophytes.
So it's not getting smaller, it's kind of getting bigger.
Yeah. The disc is narrowing.
Right.
Degenerative disc disease, the disc narrows, more stress placed on the bone reacts by laying down extra calcium. That's the only thing bone can do. It can either reabsorb itself or lay down more bone. Bone either goes away or bone gets increased. So it's increasing the bone as a reaction to the extra stress placed on it from the degeneration of the disc. So the disc starts to narrow often first, then the bone responds by laying down extra calcium, and then you get either facet arthrosis or end plate arthrosis. Yeah. Well, that's kind of what I'm saying is that degenerative disc disease is when it affects the disc itself. So you get chemical changes in the disc where it doesn't rehydrate as much. So the issues are loss of disc height and disc degeneration, chemical changes in the annulus fibrosus and the nucleus pulposus where the disc is wearing out. Right? That can cause degenerative joint disease. Sometimes you might look at sources where they'll talk about it as this all part of the same thing. Discs and bone are both part of degenerative joint disease. But you can technically separate it between, basically there's three things that degenerate. There's one is the disc, two is the end plates of the vertebra, and the more the disc degenerates, the more that makes the vertebra change. And then you have the facets, which are on the backside. Most of the joints of the body don't have discs. So you talk about DJD, you're talking about DJD in your shoulder, in your knees, in your hips, things like that. But when you talk about an area that has a disc, like we talked about in the wrist, right? You've got a disc in there. You have degenerative disc disease right there. You don't really hear about it, which technically could happen here too. So sometimes they are lumped together, but just technically be able to understand that pathologically different structures are affected, but they usually go together. And it's not that much of a problem just to lump it all together and say DJD of the spine. So then the main thing to remember is that it can affect the IVF. So you can have radiating dermatomal, myotomal nerve root problems, or it can affect the whole spinal cord from that point down. So that's when you have central canal stenosis. So then with DJD, they're going to have the chronic low back pain, same other types of things. And then the symptoms of degenerative joint disease and degenerative disc disease are probably going to be similar. When's it going to hurt them? In the morning or during the day? Usually, or periods of activity. Obviously, if they work graveyard, it's going to be different. But following periods of inactivity, they're stiff once they get going. It's like a joint. It's a disease of inertia. Once you're in motion, you're okay. Once you're at rest, you're okay, but it's going in between where you have the problems. And then barometric pressure, things like that. So they may have they may not have full range of motion, and it may not be because of pain. Like if you're doing passive range of motion on someone on their neck, and just like if you're doing active range of motion, they can only turn their neck that far. And you go to do it like that, and you can feel a hard bony end plate, a bony end feel. And yeah, the bone just doesn't let it happen. So obviously X-ray is where you're going to find some of this. Then osteoporosis, obviously, is weakening of the bone, typically found in postmenopausal females. You're going to have wedging of the vertebra. Again, you get this compression fractures that happens like this, where the weak part of the vertebra is in the front. So they're going to have this kind of thing. You're going to see it more in the thoracic spine, but you can't have compression fractures in the lumbar spine. Let's say somebody has osteoporosis, and then they step down or they fall or something, and then they get a compression fracture in the lumbar spine. So again, here you can see there's the vertebra that's fractured, and again, the weakened area is in the front, so that's why it collapses there. Okay, so now we're moving into contractile tissue problems. So you have gluteus medius weakness. That could be either chronic or acute. You could have disruption of the nerve, where you're going to have weakness to the gluteus medius. Okay, so you may have chronic back or hip pain, some occupational strain. They're going to have problems with the gluteus medius. So they may going to have weakness in hip abduction. Muscle strains, again, you're going to be more susceptible to that if you have the chronic cross-postural syndrome, where you're having the tight extensor muscles, weak flexors, hyperextension. Again, then you're going to have tight gluteals. And then that can set the stage for more facet joint problems, nerve impingement problems, things like that. Just a progressive thing that starts out with muscle, postular types of things that can be more susceptible to affecting the nerves. So now we get into sciatica. Okay, so sciatica a lot of times is just a garbage can term that just means pain down the back of the leg. So, somebody says, oh, I got sciatica. What causes sciatica? Well, it depends on what it is. If it's a nerve root problem, it could be a disc herniation, it could be piriformis muscle problem. Could even be an entrapment of the nerve, maybe somewhere in the knee where it's going down into that area. So there's a lot of different things that can be causative of sciatica. Sciatica is just like saying, well, I got pain in my leg. Right? So it doesn't tell, it's not really a pathological description, it's just a symptomatic location that just says, well, I got pain in my leg. So it can be anywhere from starting typically in the buttocks. Here's where the sciatic nerve comes out with the piriformis muscle. Sometimes a certain population of people that it comes out right in the middle of the of the piriformis muscle. So obviously you're going to be more prone to piriformis syndrome problems. When that muscle contracts, it's going to affect that nerve. So something that's mechanically stressing that area, irritation to the low back, or it's like a repetitive contraction of the sciatic nerve. And then again, here's the peripheral nerve distribution of the sciatic nerve. Once you get below the knee, then it divides into the tibial and the common peroneal. So sometimes you can have neurologic changes, you can have weakness of the muscle, you can have sensory changes. As far as special tests, depends on what's irritating that sciatic nerve. Straight leg raise, that could show up if you have disc herniations, it could show up if you have piriformis problems or irritation to the sciatic nerve. Sitting root test.